Everybody, thank you all for joining us so much, and thank you for having patience and bearing with us while we get everything set up so we can go ahead and go live and, of course, share this presentation with as many people as possible. We do have about 70 participants on just the Zoom alone with us, and I know that our Facebook Live team, Patrick Espinosa, our communications director at the Hispanic Chamber, is standing by on Facebook Live to go ahead and take your questions if you're tuning in that way. My name is Michelle Luevno. I am the project director for the Minority Women's Enterprise Diversity Center at the El Paso Hispanic Chamber of Commerce. It is my pleasure to welcome what I consider an all-star group of panelists today to really focus on construction and COVID-19 and staying safe on the job site. So many of our construction workers are out working right now, trying to keep this economy going, making sure that those essential projects are being taken care of. And we want to make sure that they're also being taken care of on the job site. So like I said, we have basically put together an all-star panel for you all. I want to thank Angie Rosales from Sunt Construction for helping to put together this panel. And also, of course, I want to thank UT Health Sciences Center out in Houston for providing the all-stars for this panel. So without further ado, I'm going to go ahead and get into a little bit of what we are going to cover right now. So today we're going to be discussing creating a safe, healthy, and functional work site while protecting your employees from COVID-19. The following information is going to be covered. So the basics of COVID-19 and how it can spread at your job site, practical ways of ensuring a healthy and safe construction job site, how to reuse and sterilize your PPE equipment properly, which is so extremely important during this time right now. Then we're going to go over some resources available to you and your employees during this time, and then we will wrap it up with a question and answer session with all of our panel of health and safety experts. If you are tuning in via Facebook Live, you can submit your questions via the comment section, and if you are tuning in on Zoom, you can actually submit your questions in two ways. Either one, you can use the question and answer panel provided, or two, at the end of the presentation, you can go ahead and raise your hand and we will unmute you so you can go ahead and ask your question live on the air. Before we actually get into the presentation, I do want to take a few minutes to introduce our panelists. Like I said, they are all rock stars that we have on this panel today, and we are so extremely grateful for them to join us on this panel. So I'm going to start off with Dr. Rob, aka Safety Bob, Robert, aka Safety Bob Emery, who is the Vice President for Safety, Health, Environment, and Risk Management at UT Health and a Professor of Occupational Health at UT Health School of Public Health. As one of two principal investigators for the Texas-Utah Consortium, Dr. Emery works closely with Dr. Rios in leading this training program. He is also an instructor for the Texas-Utah Consortium and BIDTI. He is an established leader in public health and environmental sciences. He is an established leader in public health and biosafety. Dr. Emery holds master's degrees in health, physics, and environmental sciences and a doctorate in occupational health. Now get ready for this, everybody. He is certified in all 7 of the main areas of health and safety, which includes health physics, industrial hygiene, biological safety, occupational safety, hazards material management, and more. Dr. Emery has over 30 years of experience in health, safety, and environment, and has authored over 70 peer-reviewed journal articles and book chapters. So thank you so much, Dr. Emery. I know that you're not going to be able to be with us for the entire presentation because you're extremely busy, but we are so grateful to have you here joining us today.
My
Next
pleasure.
up, I would like to, thank you. Next up, I would like to introduce Tommy Hysler. He is the Chief Medical Officer at the Houston Area Safety Council, where he also serves as Vice President of Health Operations. He is board certified in occupational medicine and is a frequent speaker at regional and national safety and health conferences on areas of OSHA standards and recordability, occupational diseases, and medical fitness for duty. He also sits on the National Safety Council's Physician Speakers Bureau, as well as the University of Texas Residency Advisory Committee. So Dr. Hysler, thank you for joining us today.
Pleasure, thank you.
Next up is Dr. William Brett Perkison, who is currently an assistant professor at the University of Texas School of Public Health in the Division of Occupational and Environmental Sciences. He holds a joint appointment at the UT Health Department of Family Medicine. His research interests include developing improving participation in worksite diabetes prevention programs and worksite disaster preparedness related to the effects of climate change. He is the president of TXCOEM and is currently serving on the Council on Policy Affairs for the American College of Occupational and Environmental Medicine. Thank you so much for joining us today, Dr. Perkison.
Glad to be here. Thanks.
And next up is El Paso's own Dr. Cristina Mena. She is Dean of the El Paso campus of UT Health Houston School of Public Health. I think a lot of people overlook that we do have one of these amazing campuses here in El Paso, which is such a great resource for our hospitals and our community. Dr. Mena is an environmental microbiologist, and her area is in mitigating the transmission of pathogens in our environment to protect public health. So Dr. Mena, thank you for joining us today.
Thank you.
Next up, we have Michelle McDaniel. She is the Director of Outreach and Continuing Education Programs for the Southwest Center for Occupational and Environmental Health for the UT Health Houston School of Public Health. Prior to her current position, she worked at the University of Texas MD Anderson Cancer Center, where she worked in surgical oncology research and program coordination. She also has experience working in patient registration and community health outreach in the emergency room setting, along with nutrition and physical activity research and data management experience. So thank you, Michelle. It has been great to call you and say, hey, Michelle, it's the other Michelle on the other end. Next up, we have Dr. Janelle Rios, who is the Director of the Office of Public Health Practice and P2R Academy for the UT Health Houston School of Public Health. Ms. Rios, Dr. Rios joined UT Health School of Public Health in 2006 as a project coordinator in the Coordinating Center for Clinical Trials. After earning her doctoral degree in management and policy sciences in 2009, Rios joined the School of Public Health as a faculty associate and director of continuing education and outreach in the Southwest Center for Occupational and Environmental Health. So Dr. Rios, thank you for joining us today.
Delighted to be here. Thank you.
And last, but certainly not least, is Angie Rosales. She is the Business Development Representative for Stunt Construction Collaborative. She focuses on market sector development and helps pursue business development opportunities and implement overall marketing strategies for her defined market. She has nearly 20 years of experience in management and community engagement. So Angie, thank you for joining us today as well.
Thank you for the opportunity, and thank you to our amazing panel for agreeing to pull this together so quickly.
With all of these doctors and all of these professionals with so many years of experience, I am feeling very intimidated on the other end of this webinar, but thank you all so much. I'm sure that you all are very busy right now, and we are really grateful for you all for taking some time out of your busy schedules to talk with our construction community and really help guide them through this COVID-19 outbreak. So without further ado, I'm going to go ahead and turn it over to Dr. Perkison, who is going to go ahead and go do an overview of COVID-19 and how it can spread on the job site.
So, hey, this is Bob.
Okay, thanks so much, Michelle.
We forgot Dr. Dufresne.
Oh, I'm so sorry. I forgot Dr. Dufresne. Let me go ahead and go back over. I'm so sorry, Dr. Dufresne. I promise it was a complete oversight on my part. But Dr. Dufresne is an associate professor of the Industrial Hygiene Program Director for UT Health School of Public Health. He is professionally certified as an OSHA General Industry Outreach Trainer and an OSHA Occupational Safety and Health Standards for General Industry Trainer. He has also acted as a consultant, lending his professional expertise to companies across the country. And Dr. Dufresne, I did see that one of your clients was New Belgium Beer Company. So hopefully in this pandemic, you can all give us that connection, because we might all need a little bit more beer during this time.
I'll see what I can do.
So without further ado, now again, Dr. William Perkison to go over some of the issues surrounding COVID-19 and how it can spread on the job site.
Okay, thanks so much. So I'm just going to give a brief overview. There's been a lot of this information has been in the news, but just sort of this is a nice overall summary. We've heard the virus referred to as the coronavirus, COVID-19, sometimes SARS-CoV-2, and it really is, it's all the same virus. It's the coronavirus is the family of viruses, and it was first identified in late 2019, so hence the name. And then the SARS part, it stands for Severe Acute Respiratory Distress Syndrome. And you may recall in the early 2000s, we had an outbreak of SARS, which was also a coronavirus, but a different species of virus than what we're dealing with now. This spreads from person to person, which is why it's such a easily transmissible issue, usually through the respiratory route, and particularly when someone coughs or sneezes. And there is little immunity in humans. We as humans have not encountered this type of virus before. More information is available on the CDC website, which I would encourage you all to take a look at. They also have some great handouts there. Next slide. So transmission, as I mentioned, was respiratory route. And just to kind of clarify what that means, there's the term droplet, which really refers to any of the secretions we get from coughing or sneezing. And then if those droplets land on mucosal surfaces, that is on the nose or the mouth or your eyes, then the virus can be transmitted at that point. They also can be transmitted via aerosol, which is really one of those droplets that's suspended in the air for a period of time in the aerosol. So close contact, but not actual contact, you can also spread through the aerosol. And then lastly, contact actually touching something where the SARS virus is on it, be that a person or a paper, plastic, steel, anything that the droplet has been on recently can potentially transmit that to you. And then there's been some evidence in some studies that can be transmitted through fecal matter as well. So there's that route. Next slide. So when we hear the term incubation period, that's really in the terms of a virus, infectious disease, that's illustrates the time between when you first come in contact with the virus to when you have the onset of symptoms. And one of the issues with the COVID-19 virus is that it can be up to 14 days before somebody has symptoms. So during that time, you can be perfectly fine, and yet you can be transmitting that virus. You're most contagious when you are symptomatic. So certainly individuals that have a fever, they have a cough, those people are much more contagious than the asymptomatic people, but it still potentially can be transmitted. And so this is just a list of symptoms that we've seen with this. By far, the most common ones are on the left-hand side there, and that's people tend to present with a fever, cough, and then just a feeling of shortness of breath. And as the severity of the symptoms increase, that shortness of breath can be more dramatic, anywhere from just being sort of slightly out of breath to feeling like somebody's pushing on your chest and they can't breathe. There've been, if you've seen in the news, there've been some pretty significant symptoms that people have described what having the COVID-19 virus is like. But in addition, we've also seen a variety of other symptoms like sore throat or stuffy nose, flu-like symptoms like body aches or muscle aching, chills, fatigue, sometimes a sore ear. So there's a variety of sort of cold symptoms that this can masquerade as well. Next slide. So one thing is, you've heard a lot in the news probably is how the comparison of the influenza virus with the coronavirus. And as I mentioned, they can present very similarly. However, when you look at the mortality rate and the hospitalization rate and really all the other measurements of how severe a disease is, you can take the influenza virus and multiply that times 20 to get the numbers of people that are presenting with SARS-CoV-2. So many more symptoms. And so when you multiply times 20, the main concern that you're really worried about is, does your community have enough hospital beds? Do they have enough ICUs? Do they have enough ventilators to meet that? And while we can handle the seasonal flu, where you have this rate over a period of 6 months, in a matter of a couple weeks, to have 20 times that amount, most communities do not have that type of capability. And so that's where you get this trying to flatten the curve, trying to lower those incidence rates so that our hospital systems can take care of the number of cases that we've got. Oftentimes, the most severe symptoms are presenting with pneumonia and shortness of breath or lowered oxygen levels, and you can have up to 15 or 20% of the people with COVID-19 symptoms could present like that. And then, unlike the flu, with the flu, we do have antiviral medication that is helpful, that decreases the intensity and the duration of the flu. We don't have that for the coronavirus 19. Thus far, we don't have any medications. There, you've seen in the news probably a number of different medications that have been suggested or thought maybe, but that's all very preliminary. Right now, we don't have anything that shows clear evidence, nor do we have a vaccine, nor do we have immunity. So a lot different type of presentation for this, and something to take a lot more seriously. And again, we've included some local links for the state and the CDC to learn more information. And then lastly, just as sort of a recommendation I'll put on my occupational environmental medicine hat is that under OSHA, as employers, you do have some freedom to providing training and medical examinations for your employees and protection, that it's part of the responsibilities of keeping workers safe. And this is indeed serious enough problem that it would qualify under that. And so you do have the ability to create programs that can protect your employees while they're at the work site. That's all for my presentation. And as we go on towards the end, I'll be happy to take any questions related to health symptoms or other infectious disease issues. Thank you.
All right, this is Dave Dufreight, piping in from sunny San Antonio. And so what I'm going to be discussing is a little bit just some practical applications on your construction sites. Next slide, please. And this is not a COVID cough if you hear me clear my throat. It is allergies. So in this current situation, this environment, this is all new to many industries. There is increased scrutiny as to looking at our work sites and how best we might be able to protect our workers. The construction industry is no different than any other industry right now. The construction industry actually has always been under increased scrutiny because it is a high-risk industry. And so management of construction personnel, as well as all the different processes that go on, as well as the access to information in real time is vital. And so what I am reading, what I'm hearing firsthand are many contractors are out there scrambling to come up with sound, solid, efficient, and practical solutions to be able to keep their work sites open, as well as to maintain the safety and health of their workers. Next slide. If you do a simple Google search, you will find all over the country, construction sites are being shut down. I have not heard of any instances here in Texas, but I put up here some simple Google news headlines. Boston, Pennsylvania, New York City, up in Washington State and California. Fortunately, I haven't seen or heard anything here in Texas, but there is increased scrutiny by municipal regulators in making sure that these construction sites are abiding by the COVID recommendations. Next slide. So here are some practical considerations. These are not unique. We did not come up with these. We pulled these from the CPWR guidance handbook that I think Dr. Rios is going to present later in the presentation. But the CPWR is the Center for the Protection of Worker Rights, and they have provided outstanding resources online strictly for the construction industry. And so I listed some of these here. First and foremost, in what is a great idea is to designate a site-specific COVID officer, someone to be walking around, monitoring workers, monitoring operations, just to make sure that the COVID recommendations that have been put forth by the CDC are being executed. Most, if not all, construction work sites are already having controlled entry exits at all of these areas to not only prevent unauthorized workers or visitors coming on site just for their simple protection, but another idea is to perform simple audits of workers when they come on to make sure that they have the adequate PPEs they are needed. Ongoing safety talks, toolbox talks, tailgate talks, whatever you call them, just daily reminders. Hey, this is what we're dealing with. We need to take care of one another. We need to be looking out for one another. We need to be talking to one another. And so just daily reminders in very brief safety meetings is very much paramount. Asking workers to self-identify their symptoms. A lot of your workers don't like to talk about themselves, but it would be good if they can at least discuss or present or tell their coworkers, hey, I'm not feeling well, or present or talk to their supervisor and talk to them about what is going on and maybe pull them off the work site. Maintaining social distancing at all meetings and gatherings. I even recommend during lunch break, spreading things out outside. Don't stay indoors if at all possible, or even allowing workers to go eat their lunch in their vehicles. Just maintaining that social distancing, creating 6 feet of space between workers. Also, respirators, workers near or with others should wear NIEHS 95 respirators. Dr. Emery will talk briefly about those later, but then you also want to make sure that the workers are fitted with those and make sure that the respirators properly fit. And then another recommendation is identify and control choke points. Just looking at the situation, analyze every single dynamic on a work site and analyze and identify those areas where a bunch of workers may be coming together where that social distancing is violated, and trying to problem solve and come up with ways to maintain the social distancing, maybe doing the job in a different way. Next slide. Minimizing interactions when picking up and delivering equipment is paramount. Organizing the placement of materials, making sure that you're not, or if you can minimize workers walking through different areas where there are a bunch of people working in an area. Providing soap and running water whenever possible. If not, alcohol-based hand sanitizers is necessary. Being able to clean and disinfect high-touch surfaces. This includes shared tools, the machinery, vehicles, handrails, doorknobs, even portable toilets on construction sites, and any other areas that you might identify. This is where that COVID officer comes into play, to just walk the floor, walk the job site, and just looking for possibilities. Making disinfectants available throughout the work site, ensure that they are supplied adequately. And then these last two, I would highly stress, promoting a participatory approach. You can't expect the supervisors, the contractors to come up with all the solutions. I would encourage you to ask the workers, involve them in the problem solving process, because some of the best ideas come from those workers, because they see things every single day. And then lastly, I would encourage you to monitor the workers for any behavioral or emotional signs. What we see at work is one thing, but those workers that come on a job site, they are dealing with issues at home with spouses and children. Heck, having kids at home myself is driving me batty. And so, you know, they may be bringing on the work site some emotional issues, some behavioral issues, and those need to be identified and processed. And so I strongly encourage you to be looking for those signs and then acting accordingly. Next slide. Okay, I'm going to turn things over to my esteemed colleague, Dr. Bob Emery.
Okay, thank you, Dr. DeFreight. Just by wave of hands, you guys can hear me, I'm presuming. Yeah. So yeah, I'm Bob Emery here in Houston, and I just have one slide. And because there have been many questions asking about protective equipment, but before I get into the use and possible reuse of protective equipment, I would like to underscore that many people are focused on the protective masking, and I'm using that as a generic term because there's really some terms of art that we'll discuss here in a second. But any sort of protective masking that someone might use is in no way a substitute for some important basics. Number one is make sure that the workers are instructed, and the supervisors, if you're feeling sick, do not come to work, critically important. Number two, the notion of social distancing. And then number three is regular hand washing and or the use of hand sanitizer. Those are the underpinnings of sound public health. Now we can get into the issue of the masking. And I use that term masking generically because the guidance has kind of changed over time here, but the current recommendations with regard to the CDC is that one is encouraged to use cloth masking, which is really essentially like a bandana. There are many YouTube videos that show you how to make your own, or you can actually procure them now. The industrial enterprise seems to be kicking in with regard to the availability of these products. And so the question is, can I reuse those? And so the recommendation would be for a cloth mask that they can be reused simply by washing them in hot soapy water. We have had some questions about using a disinfectant spray like Lysol, and that would not be recommended only because that mask is now right in front of your nose and mouth, and Lysol, although it is an effective disinfectant, there could be some other issues with regard to inhaling that in a saturated cloth mask. So our recommendation would be hot soapy water, wash the stuff and then reuse it. So that's a cloth mask, which can be either commercial or homemade. The next one is a surgical mask, and you've seen, I suspect many people have seen these surgical masks. They're a pleated, they're made out of paper. They have elastics on either side. You put them around your ear. Currently, the use of the surgical mask is essentially use it for the day and then to dispose of it, because the paper product and the substrate is really not suitable for reprocessing. But it's important to understand that the surgical mask is not considered to be respiratory protection. And by that, I mean, it's not intended to protect you from inhaling something. What it's designed is to keep you from infecting someone else. And very similar to if you go into the hospital and a surgeon is going to do work on you, they wear a surgical mask in order to protect you as the patient from the doctor possibly getting you infected or sick. So that's a surgical mask. Now we get up to what I suspect many people have heard about, which is the N95. And the N95 is a specific type of respirator that offers respiratory protection for the person who wears it. In order for it to appropriately work, it needs to be fit tested. In other words, sized for your face, and then you tighten up the rubber bands, and then there's actually measurements that are done to make sure that the mask fits. But the problem we have here is that many people want N95s, but there's been a limited supply of those. And so we've had to, at least here in Houston, and I suspect in El Paso and others, we've had to triage that and limit the use of the N95s for those individuals who are at highest risk of exposure. And so in our case, it would be healthcare providers that are doing certain procedures that might be the highest risk procedure for exposure. So for example, invasive dentistry work or ear, nose, and throat, this sort of thing. But as more and more N95s are flowing into the supply chain, I can envision that others might be able to access these as well. Which brings me to my last point, and that is the issue of cleaning or reuse. And there, with regard to N95s, because they are, let me be clear, N95s are intended to be single use, but because of the severe shortage, there are actually 3 pathways that one might use to extend the life of N95s by doing some reprocessing. Number one is using UV light, and our colleagues in Nebraska have demonstrated that one can actually disinfect N95s by putting them in a room being exposed to UV light. That's number one. Number two is something called vapor phase hydrogen peroxide, which we're actually doing here in Houston, where used N95s that are not damaged are being put in a room and then being exposed to the hydrogen peroxide. And then the third one, and my colleague, Dr. Rios, may be able to speak about this a little bit, but a third intriguing opportunity is the application of dry heat. Specifically, a paper out of Stanford mentions, imagine this, baking, essentially baking the mask to 158 degrees Fahrenheit for 30 minutes. That one is still in the works, and maybe Dr. Rios can speak to this a little bit, but that's the three options that we have right now. So to close this out, I would just say, if you're using cloth masks, wash them with hot soapy water. If you have surgical masks, one per day and ditch it. And if you have N95s, ideally, we would want to rotate those out. But if not, there are three different pathways of possible reprocessing of these devices. So I'll stop there and happy to answer any questions at the end of this.
Hi, everybody. I'm Janelle Rios, and thank you for that lovely introduction. Next slide, please. As I was looking through different resources that were specific to the construction industry, there aren't a lot of things out there, but there are a few really good nuggets. And Dr. Dufresne mentioned one of them, which is the CPWR group. And I really like that one. I'm going to get a little bit deeper into the CPWR resources. Another really nice resource is the Construction Industry Alliance for Suicide Prevention. They have more than just mental health resources on their website, and I give the link here. And then finally, the National Institute of Environmental Health Sciences Worker Training Program. They have resources. They have a really fun PowerPoint presentation, both in English and Spanish, that's available to everybody as well. Next slide, please. So CPWR, in collaboration with the North America's Building Trades Union, has developed a bunch of really nice tools. And I'm going to talk about one of them because I know time is short, but this one is actually available in English and Spanish. So next slide, please. So this isn't really meant for you to read. This is just a screenshot of both of these resources. These are one-page documents, front and back, that have really the very basic information. And if you were going to take a resource on paper out to the job site, this would be the one. I would print it in both English and Spanish and give it out. This is very timely, very specific to the construction industry, and very helpful. Next slide, please. So the Construction Industry Alliance for Suicide Prevention, they also have some very nice resources. And like I said, it's more than just mental health. But keep in mind that in the construction industry, suicide is very prevalent. And it's critical, especially during this time of high stress with children at home and not going to school. Maybe a partner isn't working the same number of hours. And this is a very stressful time. And if your workers are not able to pay the rent or pay the mortgage or pay for other critical items, that they really are feeling a lot of stress. And at that time, that's when mistakes can happen on the job site, which could result in injury or, God forbid, fatalities. But specific to COVID-19, these are some longer resources. And it's written a little bit differently, and we all learn a little bit differently. So these may be really good resources for your workers as well, again, in English and in Spanish. Next slide, please. So the National Institute of Environmental Health Sciences Worker Training Program, they have a bunch of resources on a wide variety of topics. One of them is this COVID-19 training tool, and it's a series of about 50 slides that summarize COVID-19, all about the infectious pathogen itself, the SARS-CoV-2 that Dr. Perkison was mentioning. It includes other resources, different ways to stay safe on the job site. Unfortunately, there are no examples in these documents for the construction industry. However, it is applicable widely to a lot of different job sites. And I think that was the last one. Next slide, please. Yep, that was my last one. And I welcome your questions. Thank you.
Okay, so we're going to go ahead and open it up to some questions from the audience. So again, if you are tuning in with us via Zoom, you can go ahead and ask your questions via the Q&A panel. If you would like to ask your questions live, you can go ahead and raise your hand as well, and we will unmute you and you can ask your question live. If you are tuning in with us on our Facebook live stream, you can go ahead and ask your questions via the comment section. I'm going to go ahead and unmute all of our panelists right now. All right, all of our panelists are unmuted. Let me make sure we are good to go. Okay, so we did have some questions that came in via the question and answer panel. So the first one is, are they shutting down because of spread on the sites? So Dr. Dufresne, I think this question is for you. Specifically those sites that you've seen shutting down, have they seen spread on the site and that's why these construction businesses are getting shut down?
The reports that I have read, they are not reporting a spread, they are reporting a positive case. I have not yet to hear an actual spread of COVID among workers on a cut site, or sorry, on a construction site.
Okay, so we do have a question that has come in via email as well. Our question here is from El Paso Waters. So what about the need to clean and or disinfect construction tools? Not only personal tools that are used by each worker, but also tools that are usually shared by several workers. Especially how often should you be cleaning those, and really how should you be cleaning those? I'm not sure which one of our panelists wants to respond to that.
I can. It's Bob. So a couple of things there. A very similar question that arises here in Houston is the notion of high touch surfaces. So we actually have the rotation right now is that the contract housekeeping does their normal routine of cleaning, the floors and the other things that they do. But then on a second rotation later in the day, they're addressing the high touch surfaces. So things such as doorknobs, handles, railings, this sort of thing. So I think it's a really interesting question, which you bring up there. And my advice would be, it's not some magical number, but twice a day, wiping down the common use tools with a disinfectant wipe, which you can get in a canister. That combined with good hygienic practices of washing your hands and keeping your hands away from your mouth and eyes and other areas, as Dr. Perkison mentioned, those things, and I'll defer to Dr. Perkison, but to me, twice a day, that seems like it would be a reasonable approach to managing it. Dr. Perkison, would you agree with that approach?
I think Dr. Perkison,
I think he got muted. I think you're muted.
Sure.
Okay, can you hear me?
Yeah.
Yes, I
Yep.
can hear you.
Now you're muted again.
Hold on.
You're
Here, I think, staying home and not getting any exposure at all, but I think within reason and workforce management, trying to do that twice a day would lower your risks, combined with the other personal protection.
Dr. Perkison, can you repeat the first part of your answer, because we couldn't hear the first part of that?
It's almost like you're automatically going to mute. There you go.
There we go.
Got it. Okay, go ahead.
ahead, Dr. Perkison. We can hear you.
I'm sorry, I lost the audio there. Could you repeat the question?
If you could just repeat the first part of your question, I couldn't hear you on that first part.
Oh, okay. Yeah. No, I think that twice a day is reasonable. I mean, ideally, there's been some evidence that the COVID virus is viable or alive on metal or plastic surfaces for up to 3 days, and on wood or cardboard for 4 hours. So ideally, using personal protection devices with frequent wiping a couple times a day is significantly decreases your risks of getting exposure.
And if I may, this is Bob. I don't know if I'm muted or not muted, but anyhow, I would also say that this particular virus is susceptible to UV exposure. So in other words, it doesn't last long out in the environment on a surface like a table outside, because when it's exposed to UV light, it doesn't last very long. So the mere fact that one has tools that perhaps they're stored outside is in your favor. I would still suggest wiping down, twice a day, wash your hands, do those basic things. But the environmental persistence of this virus in the outside environment is not very long. And Dr. Perkison, I think it's just a couple hours, if I remember correctly.
Yes, I would agree. And the other nice thing is it doesn't do well in non-humid environments. So we've got more of a problem in Houston and El Paso. That's in your favor.
Finally, our dry heat is coming into handy for something other than keeping our hair from getting too frizzy. So I do have another question that's coming in just about gloves specifically. So should everyone be wearing gloves? I think that there's been a lot of discussion about, do you wear gloves? Do you not wear gloves? And is there a specific kind of glove that you should be wearing on the work site?
I'll take that one. Well, certainly, I suspect in a construction site, you're wearing work gloves so that you protect your hands. So they might be canvas or leather or something like that. That's fine. Those can be sprayed down at the end of the day or left out. But if one does not wear work gloves, then you could use either nitrile or latex. Either of those normal rubber gloves. I use that in air quotes. Rubber gloves are protective for the virus. But again, that's no substitute for good adherence to hand washing and or frequent use of the hand sanitizer as well.
So the next question that we have is, how often should we be disinfecting surfaces? So not just the tools that people are using, but going further than that, like surfaces as far as tables that people are eating on, those kinds of surfaces.
Well, again, I'll just take a stab at this. There's no magic number there, but I can tell you what we're doing here at the Health Science Center is twice a day, right? But of course, I'm sure others can weigh in on this, but depending on the usage, if it's more frequently used or highly trafficked, maybe you do that more. Again, I don't think you're going to be able to point to a federal guidance document that says twice a day, but I can just tell you that's what we're doing here. So, but I'd welcome feedback from others.
We've got another question coming in, and Dr. Perkison and Dr. Hysler, maybe you can answer this question. Can you address in more detail conveyance of the virus through fecal matter? Utility operations employees work to repair raw wastewater pipelines and in sewage treatment plants. What minimum precautions should these employees take considering the potential to spread the virus through fecal matter?
Tommy, I don't know if you'd like to talk about that. I'd be happy to as well.
Well, from my understanding is that this should not be a transmittable virus through fecal matter. This is a respiratory virus. So unless you were, I can see some scenarios where that might end up in fecal matter, but in general, it's not an oral fecal virus.
I would just say on top of that, I think wastewater treatment workers, I assume there is they have some respiratory or some protection that the devices that they're using. And I would think that would be sufficient. So there has been some evidence that there may be some viral particles in fecal matter, but it's not to the degree that you would expect from respiratory droplets or aerosol droplets. So anything that they're normally using to protect themselves from fecal oral transmission of other diseases like hepatitis A would be sufficient for COVID-19.
And one thing I'll just add, if I may, regarding survival studies of this novel coronavirus in different types of wastewater, both primary treated and secondary treated. It has been shown to survive in primary treated wastewater. So countries that don't implement secondary treatment, those workers may be at greater risk. But when comparing the survivability of this novel coronavirus in primary treated versus secondary treatment, it doesn't survive that much longer, and the risk is deemed to be very low in terms of wastewater workers. They probably should be more worried about perhaps aerosolized droplets containing enteroviruses.
Great information for everybody to have, especially for those utility workers that are in that industry dealing with wastewater. I do have another question coming up about work gloves. So what would you recommend work gloves actually being sprayed down with? So should you follow the same soap and water as a cloth mask, or can you sanitize them, use Lysol wipes, things like that?
This is Bob. I would, any EPA approved disinfectant. So I think where this question is going is that I have work gloves. When I say work gloves, canvas or leather gloves that I'm using each day throughout the day doing important work. My advice would just be to spray those down at the end of the day, or perhaps at the end of each shift, with any of a type of EPA registered disinfectant. And, oh, by the way, even these over-the-counter ones, most of them are things. I'm not endorsing Lysol, but I mean Lysol is a EPA-approved disinfectant for this this virus. So that's what my recommendation, and that's what we're telling our folks here to do, is that the folks that are out there working using again canvas or leather gloves. At the end of the shift, spray them down, let them dry out, and you come back the next day and you're ready to go.
Yeah, Bob, I would like to add to that. This is Dave. I got disconnected. I lost my internet. Now I'm on the phone call. But I would recommend that you tell your workers that when they get home to try to throw their work clothes directly into the washing machine as soon as possible, and they'll be wearing their work clothes around their house, just as another precautionary measure.
I think that is sage advice, and then if you're wearing that, to bolt on to what Dr. Dufresne's mentioning, throw that, if you're wearing a cloth mask that you in the work site, throw all that in the wash machine all at one time. It goes through the cycle. That would be sage advice.
So we do have another couple of questions actually on face masks. So the first one is coming from Aztec Contractors. They're asking if cloth facial covers are more for protecting yourself from the virus or protecting others from you if you happen to be carrying the virus. And I think this has been a matter of discussion on a national level of how effective are these cloth masks and what is their actual purpose. So Dr. Emery, Dr. Perkison, Dr. Hysler, can you talk about the effectiveness of these cloth masks?
Well, I'll take a stab at it here. So that the cloth masks, think of that as something akin to the surgical mask. And the intent of the cloth mask or the surgical mask is to contain any aerosols that might be coming from you to others. That's different than respiratory protection, which is to filter out what you might be breathing in. And that's what this N95 mask does. But again, because there's a shortage of the N95s, they're really being focused towards the frontline healthcare workers, the folks at highest risk. But the idea behind the people wearing the cloth mask and or the surgical mask is to protect the public from you, because you may not know that you're potentially infectious. So I'll pause there and let my colleagues weigh in on that and see if that conveyed the story, because it is confusing. I get it. Dr. Hysler or Dr. Perkison, anyone else? Dr. Mina, you guys agree with it?
Yeah, I would just add the way we approach it in the clinic is we all wear surgical masks or cloth masks for in the morning when we see patients with chronic diseases. We're basically protecting them from us. So and you think about those respiratory droplets and how a mask, just a cloth mask, can help prevent that. And then in the afternoon, when patients with suspected COVID-19 come in, that's when we wear the N95 mask because they indeed may have the virus that they're transmitting to the staff. So you can kind of think it like that.
So a follow-up question to the masks and how effective they actually are is another issue of using filters in those masks. So what kind of filter should people be using in the cloth masks? I think some people have seen people using coffee filters in the masks to try and filter out some of the bacteria. So can you guys talk a little bit about using filters in cloth masks?
This is Bob. I'm not familiar with people using filters, again, because the cloth masks are really intended to protect the public from you. But I cannot imagine that like a coffee filter or something like that really enhances the situation that much. Again, I would just encourage people to think about there's some baseline things you can do that we know darn well will protect you. And that is things such as regular hand washing, covering your cough, that sort of thing. You use a mask, that's fine. But those things sound very simple, but they're very, very powerful. So I'm not familiar with any additional filtration sorts of techniques. But again, I defer to my colleagues on this webinar. I'm not familiar with it.
Hey, Bob, this is Michelle McDaniel. Can you hear me?
Yep.
Okay. I've seen online people are selling cloth masks with PM 2.5 carbon filters.
Okay.
And it's all over the internet. So what do you think about that?
That's news to me. I'm not familiar. And are these things homemade, or are they tested in any way? Or?
I don't know. There's businesses that are selling these, and they have their cloth mask with insertable PM 2.5 carbon filters, and stating that they can last for up to 8 hours, and then the filters need to be removed, and then the masks need to be, of course, washed.
Okay. So I've not seen those. So I tell you what, Michelle, when you get a chance, can you send me one of those links or something? I'd be curious to see it. I'm not familiar with this. So.
Yeah, we can do that. And then we can provide some follow-up guidance to all their participants on anything that didn't get answered.
Sure. Okay. Yep. I mean, this is a rapidly emerging, topic, and stuff changes every day, right? And I would, one other comment real quick, I scribbled some notes and then I dropped my pen, but we're speaking specifically to the construction industry, and, the construction industry inherently is dangerous. There's a lot of stuff that goes on in construction sites, right? You got falls, you got pinch points, electrocutions, that kind of stuff. But I think the reason we're having this conversation is that in the construction site, we normally don't think about potentially infectious disease. And so that's kind of a new dimension that we have to keep in mind. So this notion of hygiene, social distancing, awareness, and going back to Dr. Dufresne's comment about the notion of designating someone to be kind of the watchdog for COVID-related activities, that's sage advice, because not everyone that's on a construction site is thinking about that sort of stuff. But if we work collectively together with some basic awareness, we can get through this.
I might just add that, I think I would assume you'll probably hear a lot of different ideas that really all of them are like coffee filters and the like, are really the equivalent of the cloth masks. Probably useful to prevent you from spreading droplets, but are not going to help you from inhaling these particles. And the N95 on the box, there is actually a NIEHS certification that has met the criteria for to be considered an N95. And it's not just a filter, but it's also how it attracts charges, electrostatic charges. So there's a lot to the construction of that. And I'd say if you want to prevent from getting that the N95 NIEHS certified is really the way to go.
Michelle, you're muted.
We do have somebody who would like to ask a question live. It looks like they are from El Paso Water as well. So let me go ahead and unmute them. There we go. So Llanos, M. Llanos with El Paso Water, if you can make sure to unmute yourself as well. Here. So that way then you can ask your question live. So I'm just waiting for our Galaxy S8 user to go ahead and unmute their microphone right now, because you are unmuted on our end. While we go ahead and allow them some time to do that, we do have some more questions to get to from the question and answer panel. So first off, since this virus is going to be around for an unknown time, will there be an action plan or a procedure checklist for construction sites to continue to operate safely?
I'll take a stab at this. It's an interesting question, but I would think that the Center for Worker Protection group is probably, if they've not created it, Dr. Rios, maybe you can weigh in on this one, but if they don't have it already, I would imagine they're going to make something that covers this. Would you agree?
Right. So, and I do want to point out that there was a mental health question and I answered it in writing. But yes, with that center, I believe they would be, because right now it's almost like we're running away from the virus. We're trying to protect ourselves from the virus. But eventually we're going to have to get used to living with this virus being in our population. And how do you maintain a regular life with regular social interactions during this new world order with COVID-19. But I do think that it's a great idea, and I'm going to bring it up to our CPWR colleagues that a checklist would be very handy. And then with mental health, I'll jump in and say something about resiliency, and going up to the NIEHS worker training program website. There is some resiliency training available at no cost. And if you'd like something that's live via WebEx or Zoom, let Michelle know and she can put it together, and I'm happy to facilitate that. Thanks.
That would be great for everybody. So let me go ahead and move on to another question that we have about training for COVID-19.
Can I pipe in right quick? I'm sorry.
Yes,
I'm sorry to interrupt. This is Dave Dufresne. Just to follow up on the last discussion on the checklist and everything, I'm going to put my safety management hat on here and recommend to all the contractors to start or to begin, if you're not already, documenting your daily activities and what you are doing on a daily basis in relation to COVID management, because you never know who might come and ask to see those records. It is that record of due diligence that you are going to be able to provide to any potential regulators down the road. So I strongly recommend that you start keeping a good record of everything that you are doing, and then that is your record or evidence of due diligence for whoever might ask for that down the road.
Okay, next question that we have is specifically about COVID-19 safety officers. And then we were also getting a question about workers' mental health status. So first of all, what kind of training should our COVID-19 safety officers have? Should they have any specialized training? And then also, what should you do if you kind of recognize the signs of emotional distress in a worker? What should be the next steps that you take?
So if you see warning signs of emotional distress and one of your colleagues, keep in mind that the construction industry has one of the highest rates of suicide. And there's a lot of reasons for that. Dr. Emery was just talking about how workers are prone to accidents on the work site, because work sites are very dangerous places with pinch points and slips, trips, falls, high, confined spaces, elevated spaces. So those are very dangerous places to be in. When workers become injured on the job, it impacts their everything about them, their family life, their economic world. Financially, they may struggle after that. They may have to go into the healthcare system and receive care. And that costs money. And I don't know how prevalent health insurance is in the industry. So this is a very difficult place for workers to be. And this is, on the flip side of that is why substance abuse problems may occur, whether it's alcohol or opioids or other pain relievers. So there's a lot of stress already in the construction industry, and COVID-19 is just adding a whole other layer to it. So be sensitive. And if you see a problem, address it immediately. And you do it gently, openly, and quickly. So you go up to your friend, oh, something happened here with video, but you go to this person, you say, I noticed that there's these behavior changes. How can I help you? What can I do for you? Call the suicide prevention hotline. And I put that in the chat box. There's also text services. So, follow up immediately. And I'll leave it at that.
I might just add, there's also a number of different venues you can pursue. There's a program called Mental Health First Aid that is a great course that might be available. I can send you that information. When I was working in industry, a lot of our employees went through that. And basically it just teaches employees about recognizing symptoms of suicide, depression, anxiety, things where they're not compensating, and sort of destigmatizes it to some extent, is one of the benefits. But other than that, if the company that you're working for has an employee assistance program, that really should be under part of what they do, is providing mental health. And even if you don't, if you have an occupational medicine clinic like a Concentra that your employees go to, I would recommend working with them on that and seeing what does your workers' comp insurance or your private insurance have. Sometimes there's psychologists that can sort of create a bond there with people so that they can reach out and consult them during this time. And that's just a really important thing. We've done that over the years when hurricanes came in, when I have people that were displaced or in financial need, that could be an important aspect to that for you.
So we do have time for one more question, because I know that everybody needs to get back to work and get back to helping some of the businesses in your community. But we do have an interesting question that popped up. So should we just go back to our normal routine and start living with this virus now rather than later? And I would really like for each of our panelists to just individually give your opinion on that question. So Dr. Emery, let's go ahead and start off with you.
I was going to say we'll go in alphabetical order, but that would be Dr. Dufresne first. But anyhow, no, I would not recommend that. I would adhere to what the recommendations are now. Stay attuned to them because they may change. I think what you're going to see going forward is a phased return where there will be some loosening of some of the controls, but I would not buck the trend right now. I think we run the risk collectively as a population. If we go back too quick, this could resurge and then become even more problematic. That's Bob. Now we'll go to Dr. Dufresne because I'm looking down the alphabetical order and I think it would be him first. So.
Sorry, I'm going by the thumbnails and how the order that they're appearing for everybody. So Dr. Dufresne, go ahead.
Geez, thanks a lot, Bob. That's a tough question. I agree with everything that Bob said. I mean, one of the good things, if there is even a silver lining in this whole COVID situation, is reminding us that we can be doing a better job with basically infection control in so many different aspects of our lives. and that includes work sites, and that does not exclude construction. And so I think that this will renew our efforts in paying closer attention to not just safety in general, but infection control and the spread of these viruses such as COVID. So from that perspective, hopefully we're not going back to the way it was. But as far as just daily living and getting back our economy going again and everything, I do think that it's going to be a slow rollout, and that's going to take time. Unfortunately, I don't think that it's going to be a flip of the switch and everything's back to the way it was. So I hope that answers the question, but there's just so many unknowns, and we just don't know how to predict how things are going to be, not just 3 months, 6 months, a year down the road, but just next week. This thing is changing nearly daily, and so, but the more data that we get, data is gold right now, and so the more data we get, it allows us to make more informed decisions.
So, Dr. Mena, let's have your answer next. And also, if you could add kind of from the El Paso perspective, what it looks like for getting back to normal for us in that kind of time frame.
Sure. Well, I think as my colleagues have already mentioned, and we can't rush back too soon. We're going to have to identify a new normal. And in my interest and my work addresses the relationship between pathogens such as coronavirus and humans. And we're going to have to really evaluate that relationship, go to counseling or whatnot, because typically when you look at relationships between humans and what we see and what we encounter in our environment, health risks and mitigation strategies are driven by the pathogen, typically. And this relationship, however, is driven by the person and decisions and behaviors. That's what we're finding. And so Dr. Rios, when she mentioned something earlier, reminded me of this. We think about the cruise ships. We've all heard of the cruise ship virus. That's norovirus. It's transmitted easily. It's everywhere on surfaces, and it's hard to control. But are people leaving cruise ships because of norovirus? No, we're still all booking those trips. But in this case, with coronavirus, what are we doing? We're taking the people off the ship. And so it's a different way of understanding what our new normal is going to be. And just like a lot of communities, El Paso is very family oriented. We have generations of families living in this community, close-knit community, and it's going to be very challenging, I think, to ease back into the way we're used to living. But we're going to have to figure out the best way to do that in this new environment.
Dr. Rios, can I go ahead and have you go next? Because I saw when I asked the question, you were vehemently shaking your head. So if you could give us your perspective on this as well.
Yes. Life is not normal right now. This is a very unusual time, very unusual. Don't shake hands. Don't hug people. Now is not the time to do that. Don't share items. Now is not the time to do that. We will eventually learn to live with COVID-19. But right now, we need to flatten the curve, meaning we need to give healthcare time to catch up with this virus and catch up with the transmission of this virus. And that means being able to test people to figure out who's got an infection, being able to treat people and having sufficient ventilators and respiratory therapists who are trained to know how to use those ventilators. That means prevention like vaccines and developing and testing those vaccines. So now is not the time to go about life as normal. Please don't do that. Construction workers are critical to the nation's infrastructure. You are important to us. So don't do those behaviors that are going to put you at risk. Please take care of yourself. Wash your hands very frequently. Avoid others. Protect your families. Drink plenty of water. Stay hydrated. So no, life is not normal right now, and don't pretend that it is, because you just put yourself at risk. Thank you.
Next up, Dr. Hysler, if you can share your perspective on the answer to that question.
Sure, absolutely. And I would totally agree with all of the speakers on today. Continue to toe the line, how difficult it might be. You know, everything that we're doing now is to prevent us from having to go through this again at a later date. So nobody wants the economy to stop again. Nobody wants the construction and other work sites to stop again. So as long as we can continue to push through and do what we can, hopefully we won't have to endure this again.
Yes, I think that we're all hoping that, you know, I think we've heard a lot about the virus potentially coming back up and being something that's seasonal, but hopefully it will not happen that way. And it's something that we can overcome by all working together, but from a distance, making sure to maintain that social distance. So Michelle, the other Michelle on the line, I'm not talking to myself. I haven't gone that crazy in quarantine just yet. Michelle, can you go ahead and share your answer to that question? And let me go ahead and share some of the resources that I know that you've got going on.
Thank you. Yeah, if you'll just get that website pulled up. So, you know, the Southwest Center for Occupational and Environmental Health has previously, during Harvey, established a great relationship with public health, city, county, and CDC officials to work together. And we think it's really important that, you know, we all look at what's going on locally, because just someone says something, you know, that's going on and pushing information out for the US or for your state. I would advise, if you can scroll down a little bit to Texas, I would advise looking at what your city and county and local health officials, public health officials, reliable health officials are pushing out there as far as information, you know, as when your local area can kind of get back to work, get back to school, get back to our lives. And then if you can go to the next tab down to national and global. So this website that we put together for you, it's just got some links to resources. And we didn't get too specific because recommendations are changing daily, sometimes hourly and by the minute. So if you go to www.swcoeh.org and click on that coronavirus resource link, you can get to all these resources. And then of course you can contact us and follow up with us or me if you have any questions, need some help, and need some training guidance. And then I can connect you to these faculty right here on this webinar today, or to other local subject matter experts in your area. No, Michelle, you're muted.
Just to let all of our attendees know, we are going to be sending out a document with all of the links that we discussed today in terms of resources, websites that you can visit. And we are also going to be compiling all of your questions, even the ones that we did not get to, and submitting another document with written responses to all of your questions in the next few days. So I'm going to go ahead and let Angie, our construction company on this panel, go ahead and wrap this up for us on the question of getting back to normal for the construction industry, and specifically for SUNT. What does getting back to normal look like, and what advice can you share with your fellow construction companies?
Thank you, Michelle. I don't think I can add much more than what's already been given by the panel, but what I can say is SUNT has done an excellent job putting together a crisis team addressing this and staying on top of local and state ordinances, in addition to CDC recommendations, and constantly updating us. So I'm going to echo what's already been said, that yes, it is going to be a process that we're going to all have to ease back into. And the other thing that I would like to add is, in addition to the resources that we've already that have been shared here today, I would like to encourage folks to go to our website, to SUNT's website, where we have an entire section on COVID-19. And that information is available to anyone who needs it. And it is both in English and Spanish. And so they're already formatted in ways that, you're used to utilizing and disseminating information and implementing it on the job sites. So we have, cleaning and disinfecting protocols on there, social distancing, basic office hygiene, transporting people and vehicles, policies to address tool cleaning as well as heavy equipment. So please use that as a resource. We are updating it as we are getting updated information. We have offices, of course, in various states. So we're keeping tabs on state and local ordinances and recommendations. So, and again, I would just like to thank the panel for coming together. This was a fantastic panel. I'd like to thank the Hispanic Chamber for just your vision in putting out information that is of tremendous value to the community in all aspects as we navigate through COVID-19, and just thank you all for your time.
We do have Dr. Perkison who asked if he could add one last thing before we go ahead and let everybody go.
Thanks. I just wanted to add that although this is a new normal, it is not going to be forever. And so, yes, we want to flatten the curve right now, but there is rapid testing to identify who has the virus. There's antibody testing to identify who has had it. And then we're working on antivirals and vaccines. So things will improve, but we just have to do these precautions right now.
Thank you all so much for joining us. I really appreciate you all for being on this panel. Dr. Emery, do you have anything that you want to add before we go? Okay. If everybody will look on your screen, I do have all of our contact information provided. So if you would like to get in touch with any of our panelists, this is all of their contact information. We will be sending out the slides along with those documents that I spoke of earlier. And the full recording of this presentation will be available within a few days. If you are looking for assistance in terms of loans to help keep your business afloat during this time, please reach out to the Hispanic Chamber. You can reach us on our website at ephcc.org or give us a call at 915-566-4066. I would also encourage all of you to tune into our business roundtable that we are doing with the City of El Paso tomorrow. That's Friday at 1 o'clock in the afternoon. We are going to be discussing the stay home, work safe order and the impact that it's having on essential businesses like yourself, and how you all are mitigating the risk on the job sites, and get some more feedback from you all about how the different directives are affecting you and your business. So definitely make sure to join that tomorrow at 1 o'clock. I want to thank all of my panelists. Again, you guys were absolutely wonderful, complete and total rock stars, and I am honored to have been able to moderate this panel with all of you. I now have a complex being on with so many different doctors and PhDs, so now I'm going to have to start looking at going back to school. Thank you, everybody. And with that, we will see you all later. Please remember to stay safe and stay healthy and practice social distancing. We will see you all next time. Thank you.
Thank you.